Hello everyone, I'm Dr. Sarah Mitchell, and welcome back to my channel where we discuss the health topics that matter most to you and your family. Today we're going to have a very important conversation that could literally save your life or dramatically improve your quality of life. If you're a man over 40, or if you love someone who is, I need you to watch this entire video. What I'm about to share with you is information that most men never receive from their doctors, and it's information that could be the difference between living a healthy, vibrant life and facing serious health complications down the road. Before we dive in, I want you to do 3 things right now. First, hit that subscribe button and ring the notification bell, because the information I share on this channel could genuinely save your life or the life of someone you care about. Second, give this video a thumbs up if you're committed to taking your health seriously. And third, I want you to comment below and let me know. Are you someone who prioritizes your health, or are you someone who tends to ignore the warning signs your body gives you? Today, we're talking about masturbation and sexual health in men over 40. Now, I know this might make some of you uncomfortable, but as a urologist with over 15 years of experience, I can tell you that this conversation is absolutely critical. The relationship between sexual activity, masturbation, and prostate health is something every man needs to understand, especially as you age. And here's what's shocking. Most men have no idea that their masturbation habits could be affecting their prostate health, their risk of cancer, their sexual function, and their overall quality of life. Some of what I'm going to tell you today will surprise you, some of it might concern you, but all of it will empower you to make better decisions about your health. Let's start with the science, because understanding what happens to your body as you age is crucial for making informed decisions about your health. When men reach their 40s, several significant changes begin to occur. Your testosterone levels start to decline by approximately 1 to 2% per year after age 30. By the time you're 50, you may have 20–30% less testosterone than you had in your 20s. This isn't just about libido. Testosterone affects your energy, muscle mass, bone density, mood, and yes, your sexual function. But here's where it gets interesting from a urological perspective. Your prostate gland, which is about the size of a walnut and surrounds your urethra, also begins to change as you age. For most men, the prostate starts to enlarge after age 40, in a condition we call benign prostatic hyperplasia, or BPH. This affects over 50% of men in their 50s and up to 90% of men in their 80s. Now, you might be wondering, what does this have to do with masturbation? Well, the connection is more significant than most people realize. Sexual activity, including masturbation, affects your prostate in several important ways. First, ejaculation helps to flush out potentially harmful substances from your prostate. Think of it like cleaning out a pipe. Regular flow helps prevent buildup. Second, sexual activity affects your hormone levels, including testosterone and prolactin, which directly impact prostate health. And third, the physical act of ejaculation exercises the muscles around your prostate, potentially helping to maintain function as you age. But here's the critical part that most men don't know. The frequency, technique, and timing of masturbation can either support your prostate health or potentially contribute to problems. And as you get older, these factors become increasingly important. Now, let's address some of the myths and misconceptions that I hear from my patients every single day. These myths aren't just wrong. They can be dangerous because they prevent men from seeking the care they need. Myth number 1. Masturbation is harmful at any age. This is absolutely false. In fact, research has shown that regular ejaculation, whether through masturbation or sexual intercourse, may actually reduce the risk of prostate cancer. A large study published in the Journal of the American Medical Association found that men who ejaculated 21 or more times per month had a 33% lower risk of prostate cancer compared to men who ejaculated 4 to 7 times per month. Myth number 2. If you're older, you should avoid masturbation because it's too taxing on your body. Again, this is not supported by medical evidence. In fact, maintaining sexual activity, including masturbation, can help preserve sexual function as you age. The old saying, use it or lose it, actually has some medical validity when it comes to sexual health. Myth number 3. Masturbation causes prostate problems. This is not only false, but the opposite may be true. Regular ejaculation may help prevent prostate problems by reducing inflammation and helping to clear out potentially harmful substances. But here's where we need to be careful, and this is where the nuance comes in. While masturbation itself isn't harmful, certain practices or changes in your patterns could indicate underlying health issues that need attention. For example, if you notice sudden changes in your ability to ejaculate, changes in the volume or consistency of your semen, pain during or after masturbation, or difficulty achieving or maintaining erection during masturbation. These could be early warning signs of prostate problems, cardiovascular issues, or other health concerns. And this brings me to something crucial that every man over 40 needs to understand. There are specific warning signs related to masturbation and sexual function that should never be ignored, especially as you get older. I want every man watching this video to understand these signs because early detection can be the difference between a simple treatment and a life-threatening condition. Warning sign number 1, blood in your semen, also called hematospermia. While this can sometimes be benign, especially in younger men, in men over 40, it should always be evaluated by a urologist. It could indicate prostate inflammation, infection, or in rare cases, prostate cancer. Warning sign number 2, persistent pain during or after ejaculation. This could indicate prostatitis, which is inflammation of the prostate, or other urological conditions that need treatment. Warning sign number 3, sudden decrease in ejaculate volume or complete absence of ejaculate during orgasm. This could indicate a blockage, retrograde ejaculation, or other issues that need medical evaluation. Warning sign number 4, difficulty achieving or maintaining erection during masturbation when this wasn't previously an issue. While erectile dysfunction can have many causes, sudden onset should be evaluated because it can be an early sign of cardiovascular disease, diabetes, or other serious conditions. I want to share something with you that might surprise you. In my practice, I've seen countless men who ignored these warning signs for months or even years because they were embarrassed to discuss them with their doctor. By the time they finally sought help, what could have been a simple treatment had become a much more complex medical issue. Gentlemen, your sexual health is not separate from your overall health. It's a window into your cardiovascular health, your hormonal health, and your urological health. Changes in sexual function, including masturbation, can be early warning signs of serious conditions like heart disease, diabetes, and yes, prostate cancer. The good news is that when caught early, most of these conditions are highly treatable. But you have to be willing to pay attention to your body and seek help when something changes. Now let's dive deeper into the relationship between masturbation and prostate health, because this is where the science gets really interesting and where you can make decisions that actively support your long-term health. Your prostate gland produces about 30% of the fluid that makes up your semen. Every time you ejaculate, you're essentially giving your prostate a workout and helping to clear out old cellular material and potentially harmful substances. Think of it like changing the oil in your car. Regular maintenance keeps everything running smoothly. Research has shown that men who ejaculate regularly have lower levels of inflammatory markers in their prostate tissue. Chronic inflammation is linked to an increased risk of prostate cancer, so anything that reduces inflammation is potentially protective. But here's what's fascinating. The protective effect seems to be most pronounced in men who maintain regular ejaculation throughout their lives, including as they age. This suggests that consistency matters more than frequency alone. However, as you get older, you need to be more mindful of how you approach masturbation. Your body is changing, your hormone levels are different, and your prostate may be more sensitive than it was when you were younger. For example, aggressive or rough masturbation techniques that might not have bothered you in your 20s could cause inflammation or irritation in your 40s, 50s, and beyond. Your refractory period, the time between ejaculations, also increases with age, so trying to maintain the same frequency you had when you were younger might actually be counterproductive. The key is finding a balance that works for your current body and health status. For most men over 40, moderate regular ejaculation, whether through masturbation or sexual intercourse, appears to be optimal for prostate health. This typically means 2 to 3 times per week, but this can vary significantly from person to person. And this brings me to an important point about technique and safety. One of the most important things I want you to understand is when masturbation habits or changes should prompt you to see a doctor. As a urologist, I can tell you that early intervention almost always leads to better outcomes. You should schedule an appointment with a urologist if you experience any of the following. First, any of the warning signs I mentioned earlier: blood in semen, pain during ejaculation, sudden changes in erectile function, or significant changes in ejaculate volume. Second, if you notice changes in your urination patterns in conjunction with changes in sexual function. This could include difficulty starting urination, weak urine stream, frequent urination especially at night, or feeling like you can't completely empty your bladder. Third, if you're over 50 and haven't had a prostate exam in the past year, or if you're over 45 with a family history of prostate cancer and haven't been screened. Sexual health and prostate health are intimately connected, and regular screening is crucial. I want to address something that I know prevents many men from seeking care: embarrassment. Gentlemen, I have these conversations with patients every single day. There is nothing you can tell me about your sexual health that I haven't heard before, and there is no question too embarrassing to ask. Your doctor needs accurate information about your sexual function to properly assess your health. This includes your masturbation habits, any changes you've noticed, and any concerns you might have. We're medical professionals. We're here to help, not to judge. And here's something that might surprise you. Many of the issues that men worry about are completely normal parts of aging and are easily treatable. But we can't help you if you don't come in and talk to us. If you're watching this video and thinking, I should probably see a doctor about some changes I've noticed, then you probably should. Trust your instincts. Your body is trying to tell you something, and it's worth getting it checked out. Now, let's talk about practical recommendations for maintaining healthy masturbation habits as you age. These are evidence-based guidelines that can help support your prostate health and overall sexual wellness. Recommendation number 1, use appropriate lubrication. As you age, your body may not produce as much natural lubrication, and dry masturbation can cause irritation and microtrauma to sensitive tissues. Use a high-quality, water-based lubricant to reduce friction and protect your skin. Recommendation number 2, be gentle with yourself. The aggressive techniques that might have worked when you were younger can cause problems as you age. Focus on gentle, consistent stimulation rather than intense or rough handling. Recommendation number 3, pay attention to timing and frequency. While regular ejaculation is beneficial, forcing yourself to maintain a frequency that feels unnatural for your current life stage isn't helpful. Listen to your body and find a rhythm that feels sustainable and enjoyable. Recommendation number 4, maintain good hygiene. This becomes increasingly important as you age because your immune system may not be as robust as it once was. Always wash your hands before and after masturbation and keep the genital area clean. Recommendation number 5, stay hydrated and maintain overall health. Your sexual function is directly connected to your cardiovascular health, so regular exercise, a healthy diet, adequate sleep, and stress management all support healthy sexual function. Recommendation number 6, don't rely on masturbation as your only form of sexual expression if you have a partner. Maintaining intimacy and connection with your partner is important for both physical and emotional health. And speaking of supporting your health, there are also nutritional factors that can support prostate health and sexual function as you age. While a healthy lifestyle is the foundation of good sexual and prostate health, there are certain supplements and natural approaches that can provide additional support, especially as you age. Research has shown that certain nutrients are particularly important for prostate health. These include lycopene, which is found in tomatoes and has been associated with reduced prostate cancer risk. Zinc, which is essential for prostate function and is found in high concentrations in the prostate gland. And saw palmetto, which may help with symptoms of benign prostatic hyperplasia. Omega-3 fatty acids, particularly from fish oil, have anti-inflammatory properties that may benefit prostate health. Vitamin D is also crucial, as deficiency has been linked to increased prostate cancer risk. However, I want to be very clear about something. Supplements should never replace a healthy diet, regular exercise, and appropriate medical care. They're meant to supplement, not substitute for, good health practices. That said, I do recommend a high-quality prostate support supplement for my patients over 40, especially those who may not be getting optimal nutrition from their diet alone. I've researched extensively and found a supplement that contains the right combination of ingredients in therapeutic doses. I've included a link to this supplement in the first comment and in the description below. This is the same supplement I recommend to my patients, and I've seen excellent results in terms of supporting prostate health and overall male wellness. Remember, any supplement regimen should be discussed with your healthcare provider, especially if you're taking medications or have existing health conditions. As we wrap up today's discussion, I want you to understand that what we've talked about today isn't just medical information, it's empowerment. Knowledge about your body and how it changes as you age gives you the power to make informed decisions about your health. The relationship between masturbation, sexual health, and prostate health is complex, but the key takeaways are simple. Regular, gentle sexual activity, including masturbation, can be beneficial for prostate health as you age. Pay attention to changes in your body and don't ignore warning signs. Maintain good hygiene and healthy practices. And most importantly, don't let embarrassment prevent you from seeking medical care. when you need it. Your sexual health is an important component of your overall health and quality of life. You deserve to age with vitality, confidence, and wellness. The information I've shared today can help you do exactly that. Now I need you to take action. First, if this video has been helpful, please hit that like button and subscribe to my channel. The YouTube algorithm needs to see that this content is valuable so it can reach more men who need this information. Your like and subscription could literally help save someone's life by getting this information in front of them. Second, I want you to comment below. Tell me, did you learn something new today? Do you have questions about anything we discussed? Are you going to make any changes to your health routine based on what you've learned? Your comments help me understand what content is most valuable to you, and they help other viewers feel less alone in their health journey. Third, please share this video with the men in your life who need this information. Whether it's your father, your brother, your husband, or your friends. This information could make a real difference in their health and quality of life. Fourth, check out that prostate support supplement I mentioned. The link is in the first comment and in the description below. Remember, supporting your prostate health is an investment in your long-term wellness and vitality. And finally, if you're experiencing any of the warning signs we discussed, please don't wait. Schedule an appointment with a urologist. Early detection and intervention can make all the difference. Thank you for watching, thank you for taking your health seriously, and thank you for being part of this community where we can discuss important health topics openly and honestly. I'll see you in the next video where we'll continue our mission of empowering you with the knowledge you need to live your healthiest life. Until then, take care of yourselves, and remember, your health is your most valuable asset. Invest in it wisely.